Mr. Trainer, please. Hi, Kevin. How are you? It's the third session today, right?
Today is the
So
third.
already,
yeah.
as I mentioned in the beginning, we would never do this as a standalone therapy. It's always combined with exercises you do by yourself, the physiotherapy, and most important, Shockwave needs a certain time to really be effective. The tissue releases growth factors after the treatment, and they are basically like fertilizer, so they need a few weeks to really be efficient. So it's a little bit about patience. You can't expect it to be gone by tomorrow. But today we're going to do the third treatment, and most often people tell me that they endured much better than the first time. How did it feel the last time after the second treatment?
It felt good, a little bit tired because of all the work I'm doing with the physio, but the pain is reducing.
I was thinking that we do a little recap before we start with the third session. I mean, this is an elbow, this is a right elbow actually. In your case it's left, but I may show your right elbow. So you have this bone here where all of the flexors of the forearm and of the wrist are actually attached to a very small area, and this area often gets overused by all the strong muscles that you exercise and trained for, but the tendon doesn't necessarily adapt as fast as the muscle can. So you have often chronic inflammation and overuse in this area. This is what we're going to treat today, spot on, right to the bone, better to say at the bone tendon in the face of the joint flexor tendons. Okay? Make yourself comfortable like last time, and then we may proceed. Last time, I think we already talked about the next steps.
Yeah.
If Shockwave alone is not helping enough, PRP injections might be the next step, and it's best being used in this order because the Shockwave is kind of preparing the tissue for accepting the PRP better. This is what we check for in about 3 weeks after this treatment, when we have the final results of the Shockwave. Okay. The last session, let's go max 20.
Wow!
And you're done.
Did it!